for a high iliac crest. So this first test is for a high ilium, high iliac crest, and it's super simple to do. And I would tell you, if you only do one test, do this one on all your clients, okay? Because this can give us a lot of information. So, super easy to do. We're going to do it both standing and seated. And if you've never done this before, all you need to do is take your index fingers, find your iliac crest right at the side of your body. Move your fingers just slightly posterior. You want to make sure your weight is distributed evenly between both feet and that your chin is up so you're not looking down, because that's going to throw something off. And simply close your eyes and see if you can feel which side is higher, if indeed one side is higher. So I'm going to do that exact same thing on our model Janet. Here, take my index fingers, come into her waist, feel for that iliac crest, the very top of it, and I have a good sense of it, and I've instructed her to have her weight evenly between both feet, chin stays up. Now I'm going to step back, extend my elbows, squat down, or you can be sitting on a stool. I can feel and I can see it on her. It may be a little harder for you to see it, but I definitely can feel that this right ilium is higher than the left. So this is the standing one, and now we have to repeat this seated. Okay, so we've established that Janet has a high right ilium in a standing position. We now need to test it in a seated position. And you only have to do this one time with a new client. In other words, you only have to test seated that once, because we're going to eliminate the possibility of a true leg length discrepancy. So I'll retest seated just like I did standing, but we're taking the legs out of the equation here. Repeat the exact same thing I just did, and she's still high right. So our interpretation there is that forces above the ilium are causing this misalignment. And the culprit there is typically our friend, the quadratus lumborum. But what if her hips had leveled out when she sat down, taking the legs out of the equation? That would be an indication of a true leg length discrepancy, and she may require lifts in her shoes or certain kinds of orthotics. It is not a contraindication to do the muscle energy technique correction for this. I have several clients with true leg length discrepancies, and it is part of how they manage their management practice for the different pain patterns that they have.